could be a case of an injury, okay, that is resulting to that kind of emergency situation. And we 2010 have told us that it is often characterized by acute injury or illness. Somebody who's been verified before may just slump. Maybe he's not complying with his regulations, his medication, and all of that. And such things, they often pose immediate risk to health, especially if you have somebody who's asthmatic around you and he's not with his Ventolin, he has a seizure or a fit. The next thing you need to be able to respond quickly so that you prevent what you call a fatality or an undesired experience. So we went on to look at the fact that these emergencies, they are not space-specific. They happen sometimes in transit. You understand that? Sometimes it could be in an exam hall for students. We've seen emergencies at different forms and at different times. Okay? So we began to look at this from the point of literature, and we also discovered that these emergency problems or medical emergencies, they are things that are familiar with us. A few months ago, we noticed, if you followed up in the media, someone came to the National Assembly for screening, and he suffered a medical emergency. The next thing we noticed, they tried to, I must say thankful, maybe the doctor was around because they were in session. You know, the next thing, please give him water, give him water. Those are the kind of responses we heard in the media at that time. But I think this presentation is coming so that we can begin to focus on that kind of skill gap and see how we want to bring people to speed. So in schools, in institutions, in workplaces, people have suffered emergencies. And Ezolu et al. Has made this point and giving us some of those things that could constitute medical emergencies. They added that this medical emergency is better demonstrated than the story we are telling now. For those of us in the industry, the smallest facility, if the people there, they are less than 12, so maybe the safety officer could be doubling as what they succeeded at, right? And in my own organization, way back, we had a situation where we run a training center, and because of the risk assessment following the nature of the training, we also had our own medical emergency arrangement. We had our tier 2 facility on site. We had tier 1, which are the DFAs, our instructors, and our course leaders all around, so that within that space of immediately, you can deploy or you can assess those competencies and those resources you need to demonstrate or to deploy for us to achieve these things. But it is not so in our public institution. The private and the government sectors, we need to come to this speed so that we can, on the same page, begin to do these things and get it right. We've seen students, we've seen teachers who had suffered such fate, and because people don't know what to do, and it will break your heart to know that sometimes when there are emergencies, the most common response you see is people bringing out their phones to do what? To begin to video and do selfie of what is happening. We think we need to change that narrative, right? So we've looked at the problem here. Is the problem of competencies. How many people are aware of what a tier 0 is supposed to do in a medical emergency? Who is the tier 0? You need to be able to identify these persons and how to cascade this kind of trainings to them. Who is a tier 1 person? What is the minimum training requirement and for the maintenance of such training? So we'll be evaluating all of that using the OPITO MERP 2019 documentation to explain all of that. Is that okay? So the next thing to look at here is literature review. From the conceptual literature, we relied on the OPITO MERP that identified and established this tier-based learning. The tier 0, the tier 1, the tier 2, where the tier 0 is everybody in a workplace. If it's a school, like in my own school where we try to use, where we use for this project, we have our faculties. We operate a college system. So there's a College of Science, College of Technology, College of Maritime and Offshore Study, and a College of Management of Computing. We also have the student hostels, all right? And there are personnel there, like the porters at the halls of residence. And the issue of medical emergencies was clearly recorded that they have had series of that. Incidentally, the porters at the hostel who is supposed to be a DFA or a first responder don't have such kind of training. If we extrapolate that to other universities or even government offices, you will find that it's a similar situation. It's a similar situation where people don't have those kind of competencies, and where we are supposed to be able to prevent on such departures or deaths will be stranded. So that's why we feel we should look at that and adopt this model. We also looked at the ISO 9001 2015, which is the QMS, and plus 7 in particular was of interest while we were reviewing this work, talking about issues of awareness. Are people aware in a medical emergency what to do? Are there telephone numbers available, displayed conspicuously to make people aware of who to call during an emergency? I've gone for audits in some places, and you will see on their billboard such information: know your first responder or know your DFs. You put their pictures, you will see their IDs, their names. And if those days in Shell, to when I worked, then we had those informations and how we were maintaining those competencies. But I don't know which government office can boast of having demonstrated this kind of readiness to prevent avoidable deaths. So on the empirical literature, we also saw that these emergencies need to be anticipated, because the average Nigerian is going through a lot. We talk about mental stresses today. It's not so. We have people who are moving, who are just looking for somebody to initiate, an assault that could lead to something else. All right. So every one of us are potential patients. All right. Then we also saw Sankey et al. In their work where they carried out medical emergency study in northwest Nigeria, and they discovered that the knowledge of medical awareness was so poor. Okay, and that's why Azumi and Opala, they came to tell us that these competencies have been identified, and where they noted that first responders and first aiders, medical doctors are all part of this medical emergency team. So before the arrival of the doctor or the core medical personnel, how are we able to manage people in such situations? That is the focus of this discussion. So in terms of the materials and method, we were able to look at literatures, the secondary data sources. We looked at the standard, which is the OPITO document I mentioned a while ago, and the ISO 9001. We also looked at, I also collect the map, which is the spatial data here now, for the school, which I used, and I was able to integrate all of this information. On the primary data sources, we developed a structured questionnaire, which we administered to the students and all the participants, both students and staff, and we collected data information related to medical emergency awareness. The issues we interrogated had to do with the core competencies of the Tier 0 and the Tier 1, which we observed to be missing in the school, right? Which was of interest to us. After we did that, we went further to carry out a simple analysis or a simulation, like a drill, to test what we were proposing. Because as we noticed that there was Tier 2 facilities, but there were no Tier 1 or Tier 0, we began to make propositions. So having made the proposition, we decided to test what we proposed by doing a drill. So we got a vehicle that we used as the ambulance to be able to assess the first aid box or an AED from the point where they are located and deploy to some persons or any emergency situation in any location of the school. We will show you all of that as we move on. And finally, all of this data were presented in tables and charts, and we generated the spatial map with which I am speaking to the outcome of the research this morning. So let me quickly move to the issues of the analysis. Demographic characteristics of respondents were evaluated, gender and all of that, but I don't think we have too much time to stay on that now. However, when we came to the issue of medical awareness, have you experienced medical emergency